So my name's Emma Williams and I'm a lung cancer nurse specialist based in Neville Hall and St Woolas Hospital. So things to look out for, symptoms that could obviously demonstrate a lung cancer would be shortness of breath, a new ongoing breathlessness, an ongoing cough, worsening cough, coughing up blood, which are called hemoptysis, pain, a new pain that's ongoing in the chest, back or shoulders, an unexplained weight loss, decreased appetite, and fatigue. They are the main sort of symptoms that we would be concerned about. If any of these symptoms develop and they've been ongoing, then obviously seek medical advice from a GP. They should then arrange an urgent chest x-ray, referral into our service where we will arrange a CT scan. The best way of preventing lung cancer is not smoking, having a healthy diet and keeping as fit and active as possible.